The music stops when you stop. Well done, well done.
This research project is funded by the Burdett Nursing Foundation, and it's an implementation project. So it's looking at how Exergames can be used with inpatients in a hospital setting. The Exergames are a form of telerehabilitation based on very robust evidence-based exercises, which is the Otago exercises and FAME exercises, which focus primarily on balance and strength. Each person that uses the games has a program set up for them. It's very much based on an assessment of their abilities and their needs. And within each of the games, a movement is identified, and then a multiple number of games can be selected for each movement. The external sensor is used to prompt, track and assess patient movements, and using that sensor then enables people to gain points for the movements that they're completing. So it becomes a very interactive, absorbing, engaging way of completing a person's exercise. The Cognigames are based on the same games, but these don't require movement, and just with the keyboard or the mouse. We've had some fantastic results in community settings, so older people in sheltered accommodation. We know that the outcomes have been statistically significant in terms of fear of falling, balance, pain, also some excellent qualitative research in terms of cognition and social interaction and function. So we had all of that evidence, but Exergames have not been used with inpatients. So the idea of the research project was to look at how we can use Exergames to increase activity and to try and incorporate it into not just a rehabilitation therapy focused activity, but one that many different members of the MDT on the ward could use, and to do it in a fun, engaging way that's also got the strong evidence background. Okay, so you're the white bird and you're catching these little flies. Well done. Well done, that's it. The patients that we're dealing with and that are using the games might have been through a number of these exercises in the past, and to sit and do 10 or 20 knee extensions whilst you're sitting is quite different if you're actually applying that to a video game where you're very much absorbed into the game. You're attempting to beat your neighbour in terms of points. You're not aware of how many repetitions you're completing, perhaps not aware of the amount of movement that you're putting your joint through, and with that also any accompanying symptoms, so any pain or pain barrier that might normally prevent you from movement.
The good way to start exercises, yes, I must admit, yeah. You're concentrating on the fish, picking the fish up, putting in the vessel, in the boat, what was on the screen. And you felt ready for it, but your foot was still going up and down. I recommend to everybody that's able to do it, you know, you're doing good.
So just do the normal knee extension, up and down, and again, just keep doing the movement. I have a real passion for getting people involved in new initiatives, and I could see how it would be a break from the norm and give people something different. Seeing how people reacted to the Exergames and the improvements that they made, it was very exciting.
Individuals who'd perhaps been less engaged in therapy would watch the games, watch other people taking part, and perhaps after 2 or 3 sessions would get involved, they'd want to have a go. Anecdotally, all of those individuals that took part really enjoyed the games. The motivational element for them was primarily around point scoring and beating their neighbour, or beating their own best score, or beating the best score in that country. Benefits from the ward perspective have included people wanting to get up and get dressed so they can complete the games, and we'd strongly recommend that that was an element of any implementation. But also perhaps individuals who are in side rooms, who are quite isolated a lot of the time, perhaps hadn't previously wanted to come out into the ward environment, to day rooms, etc., would then want to come and take part. Additional motivating factors for patients have, of course, been improvements and benefits that they see themselves with their own body, with their function, with their mood, their cognition.